The delivery of services or lack thereof has come under the spotlight this morning as Nehawu launches its public service delivery campaign. Now, this is where members of the union have gathered here in Gauteng and in the Eastern Cape province to launch the service delivery campaign. Most of them raising issue with things that have not been going well in the health sector, affecting most of the people that come to these facilities for services. We are live at the Charlotte Maxeke Academic Hospital this morning, going into the afternoon. This is where Nehawu has gathered their members to try by all means to address this issue of the lack of a service delivery. I'm going to bring into the conversation now the Nehawu Second Deputy President, Patrick Makafani, who joins us now to just give us a sense of how things are faring here at this facility and how we can expect this program to be rolled out to other facilities as well. Welcome to the SABC.
Thank you very much for the opportunity. Look, today is a big day for Nehawu. It's a launching of the National Public Service Delivery Campaign. You know that as the union, we are not just a union, but we regard ourselves as the revolutionary trade union that is guided by the principles of transformation. And therefore, this public sector service delivery campaign seeks to speak to matters that are a hindrance to delivery of the service to the people around health department and all other public sector institutions. That as the revolutionary trade union that is fighting for the well-being of its own workers, because we owe our being to the workers, but also we owe our being to the society that must get the quality services from the institutions that we are working for. So today is the launching of that campaign, basically to say we are here at Charlotte Maxeke as one of the areas of concern that the people must know that the workers who are here would have their own great concerns about the treatment from management, about how things are done generally in the management of the institution, that then becomes culminating to a hindrance of provision of the prompt and effective and quality service delivery to our people who are coming here looking for hope in this particular institution. So we are launching it here today, but as you said, it's a general public sector campaign which will be spread across all sectors in the public sector, which will go, including all other state admins and your parastatals in government, to ensure that whatever we think that is not done in a proper manner, the shortage of staff, the management levels, whether they are incompetent, will expose that, the issues that has to do with the proper running of the institution, the issues of the relationship between management and the employees, which are a hindrance in the main in ensuring that we've got a happy workforce that is able to deliver happily to the society, and therefore there's got grievances that are unresolved, matters of collective bargaining, matters of occupational health and safety, and so on, matters that still remains unresolved from the COVID-19 pandemic itself, and many other issues that we want to expose through this particular campaign.
Let's talk about the finances where these issues are concerned, because we know very well that over time the lack of funding has been affecting most of the public health facilities, and we know that as Gauteng, you have the biggest lion's share of members here in Gauteng. What have they been telling you about some of these facilities and the monies that are really lacking in terms of making sure that they are assisted in carrying out this delivery of services?
There's always a song in the public sector that the government does not have money. It's always a story that we hear. But you really cannot, let's take for example the health facility as big as this one. You cannot really be giving it the resources equivalent to when you had a lesser population of Gauteng that is relying on this institution in some few years back. You still expect the same institution to be lively and to provide the services with the same similar less budget, which was less even at the time when the population was less than that, what it is now in Gauteng. And you expect the workers here to perform miracles on those lack of resources. They've got absolutely no funding that is adequate to ensure that they give the proper treatment to our people, no adequate funding to meet the demands of the overtime that workers are expected to work in order to reach out to all the clients that come in for the services here. So we do think that the government must really begin to prioritize practically now, not on theory, as it has always been the case that health has been the key priority of the government. But when it comes to the resourcing, to improving the infrastructure, to improving the conditions of the workers here inside, to ensuring that the workers, the grievances are actually dealt with completely and they are done with, to remove maladministration and corruption to that effect, such that the finances are managed properly. We are here in this terrible state today because of that lack of prioritization by the state to say, be it a key priority, that is the health provision, so must it be that you allocate resources that are adequate to the same provision of the health services, but also to all the other public sector institutions. You do the same to ensure that public sector becomes the real matter of the society. When they need help, they will get the quality help from the institutions themselves.
All right, Patrick Makofane, thank you very much, sir, for your time coming through as the second deputy president of Nehawu, just giving us a sense of how this day and this program is expected to roll out going forward, because they're saying that it's not just limited to Charlotte Maxeke and hospitals in the Eastern Cape province, but they're going to ensure that some of these facilities are really funded adequately and the delivery of services is not hampered in one way or another. Katlego, Legodi, SABC News, Johannesburg.